All right, so this is chapter 21, the heart, introduction. So let's look at the orientation of the heart. If you remember the body cavities, the heart is located in the mediastinum, which is a subcavity of the thoracic cavity and between the two pleural cavities. So when you look at this horizontal section at the trunk, we can see we have a nice big lung here, another left lung here, so right and left. And then we have our heart, and our heart is nestled sort of between our lungs, and it's protected anteriorly by the sternum. So there's the body of the sternum. And we can see that the heart is divided in half like this. So there is a very large piece of muscle, myocardium, called the interventricular septum that divides the two ventricles. We have very, very robust side here, the left ventricle. We have openings. This is a weird way of looking at the heart, but we have a couple of openings here that we'll talk about. But just so you can realize that the heart itself is sort of nestled between the lungs and the mediastinum. We can see a couple of interesting things here, actually, before we move on. We can see that the atria, I'm sorry, not the left atrium, this descending aorta, this is a really big blood vessel that we'll look at today. It's huge, right? And then that's right next to your body of the vertebra. And look at your tiny little spinal cord running through that vertebral foramen. Here's the spinous process of your vertebra. Okay, and then we can see that we have our ribs here, which are protecting both our heart and our lungs along the lateral sides and also the posterior side. All right, so looking at it from this view, which is a little bit more clear, we have the two lungs, the two pleural cavities of where the lungs are, the mediastinum in the center, and then within the mediastinum we have the pericardial cavity. So that's where our heart's going to sit. And the words here, base and apex, under mediastinum, the base of the heart is going to be the widest part of the heart, and the apex of the heart is the point. And the point happens to be in the inferior aspect of the heart. And look at how the heart is oriented in the body, right? So it's going to be centered, but it's going to also face towards the left side. So the majority of the heart is going to occupy the left thoracic region, and it's going to actually create a depression in this left lung, and this left lung has what's called a cardiac notch for the heart to be there. So it's going to occupy a little bit more of the left side than it is on the right side, okay? And we can also see that it has a very tough connective tissue covering it. So there's a sac called the pericardial sac that runs around it. And this pericardium is going to be attached inferiorly to the diaphragm. So you notice how that connective tissue runs to the diaphragm. So the diaphragm attaches to the pericardial sac. And also above it, we have the sac hanging on to these very large blood vessels of the heart, above the heart. Okay, so let's talk about the circuits. Oh, and this is another view of the heart and where it's situated. I'm not going to ask you between what ribs the heart is located, but you can see that it does occupy predominantly the left side. The apex of the heart faces towards the left of your chest. Now, let's look at the circuits. So the heart itself is going to be responsible for pumping blood, or let me back up. The heart is going to receive blood, deoxygenated blood, or another word is oxygen poor blood, from the body. Okay, so it's going to receive that blood on the right hand side, and it's going to pump that blood to the lungs. And to the lungs, the lungs are going to get rid of the carbon dioxide waste and pick up oxygen. When the blood is oxygenated, it becomes red in color. So blue is going to represent deoxygenated blood, and red is going to represent oxygenated blood. And that oxygenated blood is going to come into the left side of the heart, and then the left side of the heart is going to pump it to the whole body. Okay, so what we say is there's two circuits. The heart's responsible for the pulmonary circuit, which is pumping the blood from the heart to the lungs. Okay, so the right side of the heart is responsible for the pulmonary circuit. So we have the word pulmonary circuit on this man's right side. Then the systemic circuit is what the left side of the heart is responsible for. The left side of the heart receives oxygen-rich blood. The oxygen-rich blood is pumped everywhere throughout the body or the system. Okay, So I want to point out another thing here is that the word arteries and veins, the correct definition for these is going to be arteries are going to carry blood away from the heart. Okay, so A for away. Veins bring blood towards the heart. So in most cases in the systemic circuit throughout your whole body, arteries are going to carry oxygenated blood, the red blood, and veins are going to carry deoxygenated blood. Okay, the veins are going to return the blood to the heart that's deoxygenated. The arteries are pumping the blood that's bright red to your body. Okay, that should make sense. In the pulmonary circuit, though, it's flipped. The arteries are blue. Why? Because the blood vessels that are pumping blood away from the heart on the pulmonary side is blue blood, right? It's deoxygenated blood. So even though the blood's pumping away from the heart, it's blue blood. So it's an artery, but it's deoxygenated. So that's why it's blue color for arteries. And on the returning side, the veins, okay, veins return blood to the heart. So this blood coming from your lungs is going towards the heart. It's a vein, but it happens to be oxygenated. It's bright red. Okay, and so in the pulmonary circuit, the sort of standard thinking about arteries and veins is flipped. So artery, the correct definition you always want to remember is arteries carry blood away from the heart and veins carry blood towards the heart. All right, so let's look at the heart itself. Let's look at the wall of the heart. So we have the word endocardium, myocardium, and pericardium. The endocardium is going to be the lining inside the heart. So in this little chunk that we have of the heart, here's the inside. So the gray material, that's going to be a one simple squamous layer of cells. And that's going to just be that lining of the heart. It's going to line the heart itself, the myocardium. It's going to line the valves. Okay, so everything on the inside has endocardium on it. The inflammation of this lining of the heart is called endocarditis, and it is an infection, sometimes caused by bacteria. The myocardium is the muscle itself, right? So if you remember the myocardium, it is a striated muscle. It is uninucleated. It's a branched muscle, and it also has intercalated discs binding two cells together. Okay, so remember all those characteristics of your myocardium. It requires oxygen, so it's an anaerobic muscle. It has many mitochondria. There is myoglobin present. Myoglobin, remember, is the pigment that stores oxygen, and it also has glycogen reserves. So your heart is very well stocked. It stores oxygen. It stores glucose in the form of glycogen. Okay, so it really does, it cannot run out of oxygen, and it cannot run out of energy, or else it's going to stop. So that's the myocardium. Myocardium is the heart muscle itself. And then let's look at the pericardium. So outside the heart, we're going to have a simple squamous layer of epithelial tissue called serous pericardium or epicardium. So let me explain. Remember way back in Unit 1 when we talked about serous membranes, and we had the serous membranes were double layered. There was the visceral layer that stays on the organ itself, and there was the parietal layer that was on the cavity that the organ is in. And between those two layers of this membrane, there was serous fluid, and that fluid was made to lubricate the movement of the organ, to reduce friction, so that the organs can move freely in size and move around a little bit without friction, without damaging the muscle or the tissue itself, right? So this is the same concept. So we have our serous membranes again. We have the visceral layer on the heart itself. So we're going to call, right, so the serous membrane, when it's in the heart, it's called serous pericardium. The visceral layer of our serous pericardium now is called epicardium. I know this is very confusing, but we want to use the word epicardium. So the epicardium is just the visceral layer of that serous pericardium. Okay, so serous membrane, double layered. The visceral layer is on the heart itself. Now we're calling that layer epicardium. All right, so there's our epicardium. Now we have our parietal, right? The serous pericardium parietal layer. Remember, there's our parietal layer on the wall, the visceral layer on the organ, and there's that space, right? Now we're calling that space the pericardial space. It's going to have our fluid. It's serous fluid, but in this case, we're calling it pericardial fluid, right? We're changing the words to reflect the heart. So one more time, we have the epicardium, the space with our pericardial fluid, and then our parietal pericardium. Now, our parietal pericardium is going to thicken, right? So we can see that this gray color gets darker and thicker. This is now going to be the fibrous pericardium, number 3 in your outline. The fibrous pericardium is what creates the toughness of this pericardial sac. So if we look at the heart, with the sac on it, right? So the heart is inside this pericardial sac. The part that's cut and reflected away, right? That's going to be that outer parietal pericardium attached to the thicker fibrous pericardium. So when you cut through that, you're exposing this space, which the fluid is going to be there, and then the visceral pericardium or epicardium is on the heart itself, and that's going to be very difficult to take away. You have to sort of really work at that, okay? So let's take a look, and then the notes go on to say, inferiorly, this fibrous pericardium attaches to the diaphragm, and superiorly attaches to the large vessels of the heart. And that's, you can see that attachment here to large vessels of the heart. And let's going back to this picture here, right? So here again is the large vessels of the heart, and then inferiorly that fibrous pericardium attached to the diaphragm. Okay, so I want to show you, this is a horse heart, and the pericardial sac has been cut open. We can see some fluid inside. In this picture that I grabbed from the internet, it's an infection of the horse's heart, so the fluid is actually a turbid straw colored. It actually should be clear. Okay, so let's talk about the anatomy of the heart. So there are, actually I'm going to stop this so we can have a shorter next section.